Welcome to Payment Matters. I'm your host, Jeff Lin. Thanks for tuning in today. On this show, we talk about the ever-changing landscape of healthcare payments and the impacts to healthcare payers, providers, and consumers. You can follow the conversation on Twitter at #PaymentMatters and follow me at Jeff B. Lin. I'm glad you're back. We are on part 2 of today's episode with David Gates and Kevin Pawl of Boston Children's Hospital. As a reminder, they are a worldwide leader in pediatric care and the treatment of complex diseases and conditions. It is a nationally ranked hospital in 10 children's specialties. You've done so much, not only the patient experience, but also your staff experience, and increasing that. What's next? What's next? And what's in store for Boston Children's over the next 5 to 10 years? Or where do you see that experience transforming itself?
I think 10 years down the road is a little too far to everything will change so quickly.
Or even 1 or 2 years.
Yeah. But I think right now our major drive is in improving our pre-arrival experience, with patient communications, taking care of their payments online, checking in like 30 days ahead of time, doing as much as possible, via portals. Also, I think that we're starting to see a big drive towards telehealth. So we have to be prepared for that. The payers aren't there yet, but as soon as the payers really start reimbursing for telehealth services, I think we're going to see a big focus on that. Yeah. And how do you if you have like telehealth in a different EMR, how do you mitigate the payment there? Make sure that you have a single feel for the family.
I think Massachusetts is a little behind in terms of the legislation regarding paying for telehealth, and I'm hoping we'll catch up very soon. But I think David's absolutely right. We've got a lot of focus on digital efforts. Call center is an area that really needs to be disrupted in a healthy way. The number of phone calls, and we've studied this a little bit. Half those phone calls are not to make appointments. So how can families and our staff interact with each other in a digital experience?
And also make it so it's not so siloed. So if you are talking to a scheduler and you want to make a payment, you can make a payment. Or if you're talking to a biller, you want to schedule your next appointment, or you have a test that needs is ready to be done, have them be able to book it. So I think breaking down a lot of those silos is key. And the payment process really does touch so many of these different areas, and if that isn't solid, which I think we found a nice solid footing with Instamed, it's not going to be a good experience for the family.
Absolutely. I also think we've built a bit of a muscle with the copay project, and I've had some execs say, why'd you start with copays? Copays are small dollars in the big picture, and I think copays were getting people off the couch and into the gym. And, now we're going to start doing some advanced exercise in the gym. Hopefully we can work on estimates and co-insurance and deductibles. But I think, like we've said previously, how much of that can we do before they arrive, before we're at the point of care, so that we can focus on the care and keep the payment experience seamless, but have it be done somewhat separate from the episode of care.
That's interesting, as I'm hearing a lot of the digital experience, and I'd be interested in your feedback or input on this question, which is, we've heard some people talk about healthcare becoming more like the Amazons or the Ubers and Lyfts, and or even like more of a retailification of healthcare. Do you think that's possible in healthcare to achieve that goal, to be more of a kind of those, kind of the Amazon Apples and the Googles of the world, or do you think it's not possible within healthcare?
I mean, I think families want choice. I think you do have some that would be very happy to click a button and have a doctor on their webcam and, pay with Apple Pay or Google Pay. I think you've got others that still want to know that they're going to talk to Betty, who works for Dr. So-and-so, and they know Betty's phone number. how do you sort of connect those? And I think one of the projects that David and I are excited to partner on is how do you have, whether you talk to Betty in the physician's office or whether you talk to our centralized scheduling unit, how do you have those different units connected where the family doesn't feel like they have to start the entire story over with what they need? Can we use customer relationship management software where we can have it feel like everyone that you talk to at Boston Children's is ready to help and understands the journey you've been on?
Got it. Yeah. So really just kind of looking at each patient as almost like a customer at the end of the day, right? They're a customer in the journey of Boston Children's.
And absolutely. I think that with your standard care, whether it's like urgent care, primary care appointments, or even just general specialty care, it could be like an Amazon. They could go to any institution. And that's what's forcing a lot of the organizations to up their game in making a better patient experience. When you also have in there your really super subspecialty care with only this diagnosis is treated at this organization, I think it's very easy to sit back and not feel you need to participate in these activities. And I'm pretty thankful that everybody has jumped on to these transformations and these changes to still provide that, even though they feel they don't necessarily need to.
Yeah, I mean, in the access realm, what is it that the family wants, and how do we use the technology to help support those changes? So, what's the patient's preference around appointments? And again, if I use the ankle sprain versus wisdom teeth versus a cardiac condition, it's interesting that things change, right? You may want far more choice when it comes to ankle sprains and wisdom teeth, and you may be willing to tolerate a little bit of difficulty because you want to see the specialist for your heart condition. And we want to be able to provide that choice. I think telehealth will definitely increase the access for a lot of the primary, secondary diagnoses. We still need to figure out how we can get people access to what we're really, our sort of niche market, I think, is the tertiary, quaternary kids, the kids that come to Boston Children's because it's the place for the condition they have.
Got it. And that's a the strive to do more for all these variety of conditions for these children is great. I guess let me ask you this, and this is probably one of our near the end here, but if as you've seen this journey over the last 20 years and you could change one thing, and not only for Boston Children's but for the entire industry of healthcare in the US, is there one thing that you would like to see if you could snap a finger and next day it happened? What would that be?
For me, and David and I we may be on different pages here. We'll see. I think there's so many different stakeholders. You've got payers, providers, patients, government. How do you have a win-win situation where families are getting the right care in the right time frame and at a reasonable cost? And how do you leverage technology, leverage telehealth, leverage maybe AI in the future to have operational efficiency so that we can reduce total medical expense? Taking your child out of school to go get a strep test and having to drive 20 miles into the city. I mean, if you live anywhere near a large city, no one's doing that anymore. You've got lots of these retail urgent care centers that you can get direct access to. Many of them are open larger hours than pediatricians. And it's something that we have to look at carefully. How do we partner with those organizations and or complement those organizations as the ecosystem evolves? I think, David's at an exciting crossroads with the technology. And, I love that he said, I don't know that I'd go 10 years out because, things are evolving so fast. On the other hand, healthcare tends to lag and,
Yeah, that's where I was going. Yeah, you do have these many stakeholders, and they're all huge. The healthcare industry as a whole is gigantic. If you factor in pharma, and you've got government, and you've got the health systems, and if you could take away the fear of change and the fear of I might not get paid X, things might go a little bit faster. Everything moves at such a slow pace because people don't want things to go wrong. They don't want them to go south. There's very little tolerance for change, I think, in the healthcare industry.
I mean, very specific to Boston Children's, I think a lot of our investments historically have been in care and research. And in the last few years, I think we have seen significant investment in administrative processes, operational changes that we can make. And I'm hoping that continues, because I think those will have an effect on the total medical expense. We've had quite a bit of growth, and most of our physicians are now on our main campus and clinical buildings, and most of our administrative functions have moved off campus because of the space constraints. But one thing that could definitely disrupt things is we've got buildings that are empty at night and on the weekends, and telehealth could happen at almost any time. So I think there's healthy disruption that could happen that could make a dramatic difference without building buildings. And it's certainly not our core competency to build buildings. We're in the care delivery business, and building buildings takes a lot of time and effort. I know David's been in a bunch of meetings about where the new age kiosks will be in these new buildings, and it would certainly be better to have less buildings and to be able to serve more patients without having all that capital expenditure on buildings. But it's going to be interesting to see what happens.
Yeah, I also think it's going to be very interesting to see, as you said, about the care could happen 24/7. As we're seeing with our workforce, our workforce is beginning to flex, in that direction. Where why do we have to be stuck to the 9 to 5 Monday through Friday time frame? We have staff who just work differently. You've got a generation coming in who don't have those types of boundaries in place. We also want to be a worldwide presence, and you have to have the flexibility and ability to staff things appropriately, around the clock in order to support that. So I think your workforce transformation is going to be key in the future.
Absolutely. I think work from home was something that was sort of taboo not too long ago.
Right.
And we've had quite a transformation in that space at Boston Children's.
Well, Kevin and David, I would say we could probably be talking for a few more hours easily. There's so much to be shared, and with all the things that you've been doing and seeing over the last 20 years. I guess last question here for the listeners here is there anything you want to share with the listeners in terms of what you're doing and about Boston Children's that we weren't able to cover today?
I think continuing to use the family voice is going to be key for us because it's a powerful agent of change, and it also keeps us honest about whether or not what we're doing is the right thing. It's very hard to debate with what the families have to say. So that's going to continue to sort of be our true north.
And I think that's just been the key that has unlocked our ability to engage in these efforts. So I think that's really focus on the family. And it does. You don't have to be a pediatric institution to focus on the family. Engage those cabs. I think the consumer advisory boards are generally thought of like just the side committee over here, and give them a little bit more. Allow them to become better stakeholders in the decisions around your hospital. At least influence them more, not just be this thing you have to have over here.
Yeah, I mean, in commercial industry, I think they embrace customers, and I know some care providers don't like to call patients customers, but if you think about the transactional side, the business side of this, they're customers and they have choice, and they could go elsewhere. And we'd like to think we've got the right care and the right physicians for them, but we also want to have a great experience. So involving them in how we create that experience and how we change that experience has certainly been key for us.
That's great. I can imagine no one can argue with the fact that it's focusing on the family and focusing on the customer. I'll say almost interchangeably in many aspects is a positive thing for all of healthcare, and those are those are wonderful things. Like to really thank you to my guests David Gates and Kevin Pawl for joining me today. These are the really important payment matters we're tackling today, and as you can see today, Boston Children's has done an amazing job of tackling these problems that are out there and really kind of improving the family experience and or the customers, however you look at it, with payments. If our listeners want to learn more about you two or even Boston Children's Hospital, where can they find you?
I'm at kevin.paul@childrens.harvard.edu.
And I'm at david.gates@childrens.harvard.edu.
Well, once again, thank you, Kevin and David, for joining me today. And thank you to all of you for listening in today. Remember that you can listen in to this episode weekdays at 4:30 a.m., 12:30 p.m., and 8:30 p.m. Eastern. You can also listen on Apple Podcasts and Google Play Music, or just say, Alexa, play Healthcare Now Radio. If you have a comment about the episode of the show, follow hashtag Payment Matters or connect with me on Twitter at Jeff B. Lin. You can learn more about the show at healthcarenowradio.com or at instamed.com. Until next time, I'm Jeff Lin. Thank you.